My name's Chris Dye. I work in epidemiology and public health. I spent many years at the World Health Organization, and I'm now based at Oxford, at least when there isn't a pandemic on. And last year, I was fortunate enough to be a visiting fellow at the Oxford Martin School. The COVID-related theme that we're going to talk about today is building back healthier, essentially. We're going to discuss the link between COVID, health, and climate change. And with me to discuss that is one of the world's foremost authorities on that topic. Andy Haines, Sir Andy Haines, has looked at this problem from all levels, from frontline medical practice to global health research. He was, during the 1980s and 1990s, professor of primary healthcare at University College London, a job that he combined with being a practicing GP in London. So he really does know what happens on the front lines of health. In 2001, he was appointed director of the London School of Hygiene and Tropical Medicine, and that's a post that he held for around about a decade. And during his 10 years directing the school, he not only managed the school's worldwide profile in public health and health research, but he also became, and he still is, a driving force for research on health and climate change, and for translating the results of that research into practice. And very importantly for the Oxford Martin School, he's been an active member of the Rockefeller Foundation Economic Council on Planetary Health, and that's work that's been hosted by the Martin School. Just before we get started, a procedural point. Andy and I are going to have a conversation for about 30 or 35 minutes. And during that, you have the opportunity to ask questions. And if you're watching on Crowdcast, but not on YouTube, on Crowdcast, you'll see at the bottom right-hand corner of your screen a little note that says ask a question. Click on that. You can post your question there. You can either write your own question or you can vote on other people's questions, and the questions that get more votes go to the top of the listers, and those questions I'll be putting to Andy in about half an hour's time. We're being recorded, so you can rewatch this broadcast, but also if you're mentioned in the Q&A, remember that that mention will go on record as well. So Andy, welcome. Thanks very much for doing this. It's fantastic to have the chance to talk with you about this. So COVID, health and climate change. Let's start with the basics and perhaps put COVID aside for a moment. And let's just talk about what we know about the links between climate and health. Why is climate change bad for our health?
Well, there are a number of reasons, Chris, why climate change is bad for our health. We often divide them into three broad categories. One is the direct effects of climate change, by which I mean the effects of extreme heat exposure, for example, or extreme weather events like floods, droughts, or probably more intense storms as well. And so we know that extreme heat exposure increases risk of death, particularly for older people, but not exclusively for older people. We know that it also reduces labor productivity, so it stops people working. If you've tried to work in very hot and humid environments, you know it becomes increasingly difficult and indeed hazardous. So many millions of people are exposed to extreme heat, and those numbers are going to be increasing over time. So a study we did a couple of years ago suggested that once we get over about 2.5 degrees heating, about pre-industrial, then over 1 billion people will be exposed to such heat, such extensive heat, such extreme heat, that in the hottest month it'd be almost impossible to work even in the shade. So, you know, that will drive a lot of people back into poverty. So there's the direct effects, which everyone kind of understands, and it's fairly straightforward. The second category is the effects that are mediated through ecosystems, natural systems. So we would include amongst that vector-borne diseases. So diseases like dengue, in some parts of the world, malaria, particularly where its spread is confined by climatic factors, like, for example, in the East African highlands, would be one example. So, but also water-related, other infectious diseases, water-related diseases food-related diseases. We'll also know that some of the algal biotoxins, some of the algal blooms, for example, are increased by climate, and they can have health effects. So there are many diseases that will be affected through this mechanism of natural systems, ecosystems, and obviously crop yield is another one. So that will have big implications for food security, particularly in those populations living in subtropical and tropical regions. The third category is the most difficult one really to quantify. And that's the category that is mediated through social and economic factors, like increasing poverty, like perhaps conflict, displacement of populations, because as a result of declining food availability or extreme events or whatever. So that's a very important category, but it's very difficult to give quantitative assessments because there are so many mediating factors. So those are the three categories of impacts. And there may be others because our understanding is incomplete, but those are at least of the three broad categories of impact that we consider.
Yeah, thanks, Andy. You referred to the scale of the problem, and on the last point, the social and economic factors, said that it was difficult to quantify. Can you give us a sense, even if it is difficult to quantify, can you give us a sense of the impact on health annually, for example, now of where we are on climate and what we'd expect in future? And I ask that because when I first was exposed to these statistics, when I worked in WHO, actually, my colleagues were attempting to calculate the effect on mortality, for example, and the figures they came up with in the first instance were only of the order of 300,000 to 400,000 deaths a year. And I say only, of course, but it's a lot of people dying. But in the context of 60 million people dying each year, and indeed even in the context of COVID now, that's a relatively small number and perhaps a rather unpersuasive number. So what are the numbers at the moment and how persuasive are they?
Well, those numbers that you quoted, your colleagues at WHO, are still the official numbers. So they talk about 250,000 excess deaths a year between 2030 and 2050. I think all of us accept that those are modest. And the reason that they're modest is because they only really try to project a few obvious categories, like the mechanisms that I've mentioned, the more direct mechanisms that I've mentioned, and some of the ones mediated through natural systems. So that is a methodological challenge, and I think many of us feel that those estimates need to be revised. Now, there's recent work going on to detect and attribute health impacts to climate change. So in the past, a few years ago, quite a lot of the work was just describing the effects of extreme heat exposure. But because of advances in methodology, in statistical methodology, employed by our colleagues in climate change research, they're now able to attribute much more confidently specific events to climate change. They can say, well, this particular event was the probability or the intensity of that event, the magnitude was increased by a certain probability as a result of human-related climate change. What we haven't done yet is to apply those rigorously to health. There are some studies that have shown, for example, if we look at the extreme heat wave of 2003, there was one quite important study that showed that about 70% of the deaths in Paris could be attributed to human-induced climate change. They wouldn't have occurred in the absence of human-induced climate change. So there have been some isolated estimates like that. And there's one in publication that some of my colleagues are leading on that I'm peripherally involved in, which will give us some numbers. I can't give you the exact numbers at the moment because they're not yet in the public domain, but they are substantial, and that's purely heat-related deaths, and that's based on data collected from around the world, many sites. So the science is advancing, but we're still not able to give very precise estimates. And one of the problems, of course, is we don't have a comparison planet on which climate change is not occurring. And many factors are occurring at the same time as climate is changing. Human health overall, of course, has improved a lot over recent decades. And our concern is that climate and other environmental changes have the potential to undermine and reverse that progress. If we wait until the signal becomes very large indeed, until we have whatever, large numbers of hundreds of thousands, millions of people dying, at that point, things will become irreversible. Remember that we can't reverse climate change in human lifespans. We don't know how to do that. So that's why we have to take a precautionary approach, and we have to act now before it becomes absolutely disastrous. But as you say, these impacts are already occurring. They are going to get worse over time. And the climatologists tell us that we have to stay to 2 degrees. That's the sort of guardrail, probably the upper limit, really, of relative safety. At the moment, we're at 1 degree, probably a bit above pre-industrial. So we don't have a lot of space to increase our greenhouse gas emissions. And we'll come back to that later, maybe. But we really need to take urgent action before the effects become absolutely devastating.
Yeah. As you said, health and climate, there are multiple interacting factors. One of the points that you've frequently made is that greenhouse gas emissions contribute to other factors that influence health, and we see statistics associated with those other factors. So, concrete example, this week a report was published on deaths associated with air pollution in Europe, putting that at around about 50,000 deaths per year. And the point that you and others have made in the past is that air pollution is a soluble problem. A contribution to air pollution is greenhouse gas emissions. So we have there the link between industrial activity, climate change, and health, which comes out as 50,000 deaths a year. So we have that kind of complexity in the statistics as well.
Yeah, I mean, I would, the work we've been doing with some of our colleagues in Germany with their atmospheric chemistry models suggests that the number of deaths attributable to the burning of fossil fuels, so due to air pollution from the burning of fossil fuels, is around about 3.6 million deaths a year per annum, something of that order. Now, you can debate because there are different exposure response relationships, which have been found in different studies. But that was the estimate that we came up with a couple of years ago from our colleagues working with atmospheric chemistry models. So there's no question that it's a big public health burden. And as you say, the important thing is that these air pollutants that damage our health right now are co-emitted when we burn fossil fuels, and indeed from a number of other anthropogenic or human-related resources, including, for example, land use, the use of ammonia and so on, fertilizers, for example, and other sources as well. There's also, of course, emissions of black carbon, which is a very fine particle, which is probably more damaging than your average black, a small particle, if you like. And that comes from other sources when we burn solid fuels in domestic settings or in transport and a range of other sources. So yeah, I don't think there's much doubt, there's no doubt at all really, that there's a lot of air pollutants co-emitted by greenhouse gases when we burn fossil fuels and other human-related resources of greenhouse gas emissions that are currently driving climate change. It's not just carbon dioxide, by the way. We often focus on carbon dioxide, which is a very important, of course, contributor. We focus on it because it's the biggest one, but also because it stays up in the atmosphere for a long time. So when you emit carbon dioxide, perhaps 15% or more of it may stay up in the atmosphere for 1,000 years or more. At the moment, we don't know how to get that out quickly and efficiently. But there are other greenhouse gases as well. Methane would be one of them. Black carbon, I've mentioned. Methane comes from gas leaks, from ruminants, of course, from anaerobic digestion ruminants, from rice paddies, and from other sources. And black carbon I've already mentioned. And then there are others as well, nitrous oxide and HFCs, hydrofluorocarbons, which are human and man-made, they're refrigerants. So quite a range, but carbon dioxide is the big one. Methane is also very, very important, some of the others too.
We're talking about the way in which climate change affects health, and we want to stop that from happening. But I'm interested also in how powerful the arguments are surrounding health for feeding back into the arguments for interventions of various kinds. And to kick off that part, one thing that struck me looking at the literature is, of all the money that's spent in combating climate change, what a large fraction of it is associated with mitigation, essentially greenhouse gas reduction, and how little of it is spent on adaptation. And it seems to me that and particularly perhaps with regard to health, or certainly importantly with regard to health, there's going to have to be much more investment in adaptation, a rebalancing essentially of investment in those two different areas. What's your view about that?
Well, I would argue that, yes, you're right, that more does need to be spent on adaptation, but that doesn't mean it should be taken from mitigation. We need to spend more on both. But remember also that the cost of clean renewable energy is falling quite dramatically. And so it is becoming increasingly competitive. But of course, we also subsidize fossil fuels and we subsidize other sources of greenhouse gas emissions, because in the sense that we don't pay the full economic costs of them, and what the economists call externalities. So we don't pay those full externalities, when we fill up our car or whatever we do, go on an airplane. We don't pay the full economic cost either of the air pollution that's generated, or indeed of the impacts of climate change itself. So we do have a somewhat dysfunctional economy that's not sending the right signals to rapidly transform the economy into a zero carbon and healthy economy. You're quite right, we need to spend more on adaptation. We absolutely should. And the other problem is that it's not just that we don't spend enough on adaptation, it's also that many of the adaptation projects that are undertaken don't include any consideration of health at all. And you can, of course, you can maladapt. You can, for example, you can protect wetlands, which is a good thing to do. But if those wetlands become breeding grounds for disease-carrying mosquitoes, then they can have adverse effects on health. Likewise, the irrigation of crops. Irrigation of crops is a good thing in general. But if you either overexploit finite water resources, like in northwest India, for example, where they're really overexploited their fossil water, then that's not sustainable. And irrigation itself can also lead to increased malaria. So one has to think about the health implications of adaptation strategies. At the moment, most adaptation strategies don't really take health into account. And also the other problem is the adaptation and the mitigation communities don't really talk to each other. So let's, for example, we can adapt to some extent, can't we, to extreme heat by just sticking in more air conditioners, But the problem with that is, first of all, you need a lot of energy to do that. Secondly, if your grid is not very reliable, in the middle of a heat wave, your grid stops working, then you put a lot more people at increased risk. Thirdly, you've got to put that heat somewhere. So you pump it out into the outdoor air, and that increases the urban heat island effect. And we know that it is already hotter than the surrounding countryside. So air conditioning can further add to the urban heat island. So all of those are examples as to why we need to integrate health much more into adaptation, and we need to integrate adaptation and mitigation much more together. I'd like to see them integrated fully. We need to think about climate action in an integrated way.
So the question that comes from that, Andy, is how? Because the health community has been saying that for a long time. You've made the point that health is missing from the argument, and I've encountered that myself very often. If one talks to people who are concerned with, say, the energy and the economics of reducing greenhouse gas emissions, they're really not very interested in talking about health as a persuasive factor for what they do. In other words, putting the health into the economics, if that's the way it should be done. Yeah. So how can we make more progress in getting health into the argument?
Well, I think there's a number of things we can do. I think, first of all, COVID has put things in a different light. I mean, we've also seen the real dangers of ignoring health in public policy, and the fact that, disease control, public health, healthcare infrastructure has not been high enough profile in many countries in the public policy discourse. And we're paying the price to some extent for that now, for the fact that we really haven't taken these issues seriously. I mean, scientists have been saying for years we're going to have another pandemic, and yet it often hasn't really been factored in to, preparedness planning at the national and the subnational level. So I think it's really focused people's minds, and suddenly everyone's become aware, first of all, of how precious our health and the health of our loved ones is, and the impacts of ignoring health threats. And my fear, I suppose, is that climate change, is over the horizon, coming over the horizon very rapidly. Once we get out of COVID, then climate change will become, the effects of it become more apparent. So that is one factor, that we are now in a different situation where suddenly public health is on the front line of public policy. People are talking about it. Prime ministers, cabinets are thinking and talking about public health, which is something totally different. They haven't done that for many, many decades, arguably.
So that brings us nicely, Andy, into the role of COVID in this argument. And what we want to look at is what the opportunities are that COVID presents. And you just touched on some of those. But I'd just like to have a word from you about the collateral damage associated with COVID as well, and health and climate change. What are the bad effects? The kind of thing that comes to mind is that we know we live in a highly unequal world so far as health and economics and society goes. And apparently COVID has exacerbated that problem. So it's made our health challenges bigger in some ways. But what's your view about the collateral damage associated with COVID?
Well, it's set us back a long way, hasn't it, in terms of issues like universal health coverage, inequities. Even in high-income countries, we have increased the waiting list for urgent care of conditions like cancer and reduced consultations for, severe heart disease and so on. So we know that it's having a lot of collateral damage. It is increasing inequalities. At the same time, at the moment, in many countries in sub-Saharan Africa, we haven't perhaps seen some of the massive impacts that many of us were concerned about at the beginning. So obviously, South Africa is in the middle of a difficult situation, but other parts of sub-Saharan Africa so far are doing well, and we can debate the reason for that. But it hasn't worked out quite the way people envisaged. But in many countries, COVID is increasing inequities, and we're seeing that in its most starkest, really, in countries like the US, where there are financial barriers to accessing care, of course, and where the safety nets may not be to the same level as they are in some other high-income countries. And inevitably, because of the recovery, the immense financial resources needed to service the debt and the recovery from COVID, the danger is that might suck out much needed investment funds from climate change adaptation and mitigation. So that is a concern. But against that, we have to say that there are also policies that can benefit health, benefit climate, and therefore I think we can justify them, even this difficult period of post-COVID emergence. And what we've been arguing for, a number of us have been writing, saying, well, what we need in investing in supporting the economy as it comes out from COVID is to invest in interventions, technologies, strategies, and sectors which can integrate health, environmental sustainability, and economic sustainability, including livelihoods and employment. And we know, for example, investing in low carbon energy is much more likely to produces more jobs per $1 million than investing in fossil fuels. So in coming out of COVID, it makes sense to invest in sectors which will provide more productive employment, as well as reducing exposures to hazardous substances like in air pollution, for example.
Yeah, but to come back to my earlier point, does the public health community, yourself and others, have a seat at the table at that discussion at the moment?
Well,
where are the opportunities?
You're right to say that it has been overlooked, and it has been rather marginalised. I think, though, things are changing. I mean, since the early 90s, IPCC, the Intergovernmental Panel on Climate Change, first brought health into this debate in 1996, and that was a small step, but it's got progressively larger on each occasion in the IPCC report, and it's increasingly moving to center stage. So we're now seeing, I think, a real appreciation that if you ignore health, then you will store up a lot more trouble for the future. For the first time, we're seeing some of the major players in climate change. We're seeing a lot of interest, for example, from the UN climate champions. I think the UK and other governments are really becoming much more aware of the interrelationships between climate change and human health. So I do think things are changing. Now, whether they're changing quickly enough, of course, that's a very legitimate question. And we don't know the answer to that yet.
The other aspect of that is whether not only are they changing quickly enough, but having changed, will they stay changed, as it were? In other words, is it sustainable? You suggested earlier that this is a moment on which we can capitalize It seems to me that the way to do that would be to essentially hardwire health into the recovery, into the COVID recovery system. And we need instruments to do that. So that there are a number coming up on the horizon, and the UK, where we're sitting at the moment, is potentially an important player in that. We have G7 coming up in June. We have the next COP meeting, the Conference of the Parties relevant to climate change, that the UK is steering in Glasgow in November. How can we use instruments of that kind to make the point and ensure that it stays made and that it sets us essentially on a sustainable path?
Well, I think there's a number of arguments we can make. The first argument is that health is not just a function of healthcare. And actually, in governments, the people who run energy policy, housing policy, transport, food and agriculture, they are all, in a sense, ministers of health, because they're all influenced health determinants. And I think that's news to a lot of people in those positions, that their policies and the actions that they take will have profound and far-reaching impacts on human health. That's the first thing, I think, to say to people. And I think that's beginning to be dawning on people, partly as a result of COVID. People are becoming aware of these wider social and environmental determinants on human health. I think the other point is that the health sector itself is becoming really active in this. And we're seeing health professionals speaking out. We know that the healthcare sector itself is a major emitter of greenhouse gas emissions. If it was a country, it would be about the 5th largest emitter on the planet, something of that order. And healthcare professionals are becoming aware that their activities are contributing to the problem of climate change. And they are advocating for decarbonisation of the healthcare sector. Now, the healthcare sector is only about 5% of global emissions, but it has a disproportionate impact because, first of all, people are taking more notice of healthcare professionals now, but also healthcare procures. It procures pharmaceuticals, it procures medical equipment, ambulances. And so by working with other sectors to put in place low carbon or zero carbon procurement policies, they can have a major amplifying effect on this whole race to zero emissions. And final point I would say is about the point you were making, Chris, about how we price, how our economy functions. So we can't go on having this model of subsidizing damage to our own ill health. That is not working. What we have to do is to internalize these so-called externalities that economists tell us about. We have to price carbon realistically. We know that only about 22% or so of carbon emissions are covered by carbon pricing, and most of that's far too low to really have an effect on carbon emissions. So we have to price it realistically, but we have to do so in a way that doesn't disadvantage the poor, as we saw in the whole Gilets jaunes controversy. If you put in place ill-judged policies which put the burden disproportionately on the poor, that will cause an enormous reaction. So the income that is released by actually changing the tax system should help to offset some of the tax burden to those more disadvantaged groups. So it is a question of reforming our tax and finance system to reflect these externalities and to bring us along a more sustainable path, and to accelerate the transition to zero carbon technologies, which are becoming more affordable in any event.
Yeah, there may be a rather profound message in what you're saying, Andy, with regard to the way in which the health community has to change its mode of operation. And what I'm thinking about is it needs to be a bit shrewder diplomatically. You referred to Gilets jaunes, and I live in France myself, so I've been exposed to it. That the Gilets jaunes problem arose not simply because of a rise in petrol prices, but because it was bound to other things in the economy, particularly levels of unemployment. So this was just one extra thing. But it's a lesson in framing a problem too narrowly, if you like. If you think about the Gilets jaunes problem solely in terms of fuel pricing, then a big point is being missed. Yeah. So I think we need some shrewd operation among in the public health sector as well, so that we can handle effects like that.
Yeah, I mean, that's right, Chris. I mean,
I just want to come back to the US.
Yeah.
Yeah. Sorry, Andy.
I was going to say, I use the work as a young GP trainee. I used to work in a mining valley, a former mining valley in South Wales. And I became very aware at first hand of how coal mining communities that had really, their work has kind of fueled the Industrial Revolution, then were neglected as less coal was burnt and alternative sources of energy were sought. So it seems to me, it became very apparent to me as a doctor, that one absolutely should not leave behind those communities that had contributed so much to our industrial base and had delivered the kind of energy that was required to power industrial processes for centuries, for decades. So in emerging from a fossil fuel powered economy, we need to do so leaving no one behind and making sure that those communities that have contributed and become dependent on fossil fuel activities are not disadvantaged, and indeed are helped to achieve sustainable employment, including through renewable energy, other sources of employment, which can provide productive employment and reduce inequality. So that, I think, is going to be a crucial part of any strategy to emerge from COVID on a zero carbon trajectory. So it seems like we've lost Chris temporarily.
Hi, yes, we've lost Chris temporarily. So what I'm going to do, Andy, if you don't mind, is ask one of the questions from the audience.
Please do.
So I'm going to go with the first one by Alistair Cameron. Is there any quality research being conducted on the psychological effects on children and teenagers on the levels of anxiety triggered by awareness of climate crisis issues?
Well, thanks. It's a really important question, and the whole impact of climate change on mental health is increasingly being studied. So there's a number of issues here. One is the effects of climate change itself on mental health. So there's this concept of solastalgia, which is the grief associated with environmental change. And that's been observed in communities, quite disparate communities, as wide as apart geographically as those people in the Arctic who are being displaced by melting, their communities are being displaced by melting ice, farmers in Australia that have seen their livelihood disappear due to drought and so on. So we are seeing that climate change is not just a threat to physical health, but also to mental health. And when you follow up people after flooding, for example, you see long-standing health effects of increased depression and other common mental disorders. But the question you asked was more about young people and their concerns about climate anxiety. And indeed, there is an increasing interest in that area and concern about it, and the distress that's been expressed by many young people. I suppose one of the questions is, how do we deal with that productively, and how do we deal with feelings of impotence and anger and rage and perhaps grief, and the feeling that people are being cheated out of their futures, which I can fully empathize with and understand. And I don't have an easy answer to that, but I do think that focusing on solutions is really important. So understanding what we can do and how we can work productively together to try and solve this issue, I think is going to be absolutely crucial. And one of the new projects that we're working on is something called the Pathfinder Initiative. The Pathfinder Initiative, funded by the Wellcome Trust and the Oak Foundation, really aims to identify potential solutions, but not just to identify them, to understand what actually happens when you try to implement change on the ground. So what actually happens when someone, say a city leader, a mayor, tries to implement policies to decarbonize the energy sector or the buildings or the transport sector? How does that happen? What are the barriers and facilitators to change? What are the lessons that we can actually learn? And so what we want to do is to work with communities, with young people, to harness their good ideas about the transformations that are needed, but also to understand what happens on the ground when you actually try to implement change. We're seeing, for example, citizens' assemblies coming up with all sorts of really quite ambitious and radical proposals for decarbonizing the economy. So what we need to do now is to see how those actually play out when you implement them. And there will be winners and losers. Some people will gain immediately, and some people will find it more difficult. How do we accommodate those different interests is an important question for us to answer. So, as I say, I think it's really important to try and turn this around, and let's try to strategize together about what the solutions might be and learn lessons from the implementation of decarbonization policies.
Thank you. And I'll move on to the next question, if I may. This is by Artemis. If researchers can demonstrate direct causal links between some aspects of inequality, e.g. in housing or education, and worse health outcomes related to COVID-19, governments will be forced to listen and may be forced to act. Are we likely to see such research emerge from this pandemic?
Well, there's a great deal going on at the moment. And I think what you're referring to is causal links, between inequalities and COVID. And there's a great deal now that we are learning about that. As you know, a lot has been written about how inequalities are amplifying the impact of COVID. We're pretty sure that housing, for example, is one of the factors. Overcrowded housing, the transmission of COVID between generations, brought into the households by younger members of the family who may be mixing more, and then transmitted to older members where the risk is much higher. So we also know that many people from ethnic minorities work in positions, in jobs, where they can't necessarily take time off. They don't necessarily get full payments because they're in casual jobs. They're also more exposed to the virus because of their occupational hazards of exposure. And so the risks to them are amplified. So I think it has made it very clear and very transparent. And as a result of that, governments around the world have been under greater pressure to ensure that some of these inequities are addressed. Of course, it's extremely difficult to do so in the middle of an emergency, in the middle of a pandemic. But I think it does mean that as we emerge from the pandemic, as I hope we will over coming months, assuming the vaccine can be scaled up and its effectiveness remains, then we need to think about policies that could help to reduce these impacts in the future. And there are some obvious ones, like, for example, retrofitting housing to make it lower energy use, much lower energy demands, more warmer, more comfortable housing, less cold exposure in houses, less mold, less damp, which will also help to reduce greenhouse gas emissions, but also improve health. Improve ventilation in houses. You can't just seal houses up, because if you do so, that traps pollutants in houses. So you've also got to include in your retrofitting program, as well as replacing windows, doing insulation and so on, better ventilation, and perhaps better ventilation reduce humidity. Hopefully could also reduce COVID exposure in houses. We don't know for sure, but it probably could reduce transmission of COVID in houses as well. There's a lot of research that needs to be done on how we can make the indoor environment less conducive to COVID transmission. So demonstrating inequalities doesn't always result in government action, but I think certainly COVID has set these inequalities into very sharp relief and has increased the pressures on governments, including here in the UK, to address some of the blatant and sometimes increasing inequalities that have been exposed and magnified by COVID.
When I got chopped out, you were talking about your experience as a GP in a mining community, I think. Did you get to the end of that?
Yes, I think I got to the end of that. I remember the point I was making was that as a GP in a mining community, I became very aware of the disastrous impacts of abandoning communities. You know, once this is a community that's created so much wealth and generated so much energy for the Industrial Revolution and so on. And then once coal was no longer being used, it was abandoned. So the point I was making is that we need to leave no one behind. And that's partly because why we're seeing a lot of populism at the moment, I think, is because certain sectors are being, if you like, abandoned, or not fully catered for in public policy. And we need to think about policies that will provide productive employment in sectors that can help to reduce greenhouse gas emissions. And there are a number of opportunities, I think, to do that in a whole range of different settings, whether that be in renewable energy, wind energy, housing, retrofitting, insulation, nature-based solutions, and so on.
Yeah, so I'm really sorry about the disjunction in the conversation, but there was one thing I wanted to bring you back to, actually, which is the US, which you mentioned. Of course, we can't let pass that this is the first day of a new administration in the United States. And of course, there's a lot of optimism that goes around that. And some things appear to have been rectified very quickly, such as rejoining the Paris Agreement, rejoining WHO, which is, of course, was expected, but is a huge relief, I think, for people in WHO. But on the geopolitics of this, how do you see things changing as a result of that?
Well, I think it's going to be a big impact. Of course, we know that the incoming administration has a very thin majority in the Senate, in particular. So it isn't going to be easy. But I think already the rhetoric is completely changed, and we're into a much more constructive dialogue. And it's an opportunity, I think, really to interact with policymakers in the US. We are aware that some of the major players in the US system, in our case, it's the National Academy of Medicine and the National Academy of Sciences, Engineering and Medicine more broadly. They are very concerned about climate change and increasingly aware of the links between climate change and health. And this year, the theme for the conference, or late last year, the theme for their conference was climate change and COVID. It was these twin crises and how the health sector can engage with them. And so that feeds right in to the concerns of the incoming Biden administration. And we know that some of the colleagues, people like Gina McCarthy, for example, who's now the domestic climate czar under Biden, she is someone who's been involved in public health for many years. She understands the arguments extremely well. She's very well attuned to the argument of climate health co-benefits of low carbon strategies. And I think she will employ some of those arguments in the UK context. So I think we can look to certainly major changes as we move forward. But remember that in the US, even when there was a government that was hostile to action, there was a lot of subnational activity going on. So we saw many of the states taking very strong positions around climate change. We saw California and other states committing to rapid decarbonization. And those activities have been going on even while the previous administration was in power and doing its best to block progress. So those, I think, will be accelerated with the new administration. So it is a major shift. It will also weaken the position of other naysayers like the Brazilian government, the Bolsonaro administration in Brazil, which was quite dependent on the Trump administration to, amplify its messages and so on. Those kind of administrations will have much less international support now. We've seen the EU with its climate change mitigation target. The Chinese have said they will decarbonize by 2060. It's a bit late, but it's still, a commitment we can build on and work with. So we are in, I think, a much stronger position than we were, even, I say we are those people who are concerned about climate change and health, than we were even 6 months ago. So cautious optimism, no complacency at all, of course, but some cautious optimism.
There is the view, that leads on to the next point, that there is the view that once things begin to move, there'll be a landslide, a cascade of events which push the movement towards mitigation and adaptation towards climate change very rapidly, much more rapidly. So there is that view, and then there is the opposing view, the more pessimistic view, if you like, saying, well, if you look at what's happened this year, for example, around COVID, what we've done is essentially lock down the planet. And in locking down the planet, we've still only seen an 8% reduction in greenhouse gas emissions. And so how on earth are we going to sustain that when we return to something like normal after COVID? So there are polar opposites in opinions. Where does I know you can be optimistic about this, but being objective, how do you see that playing out?
Well, I think what we're seeing at the moment is we're seeing a lot of rhetoric around decarbonisation. So, and this will happen more now with the leadership of the Biden administration. So, as you pointed out, is that gap between the rhetoric and the reality. So what's actually happening on the ground? And on the ground, progress is much slower. And that's because some of it is lock-in. We have infrastructures which were built for fossil fuel energy, and it's not easy to suddenly switch from that. We can move towards electric vehicles, but that's quite costly and will take time. And the danger is that as the high-income countries move to electric vehicles, they will then export all their second-hand or third-hand fossil fuel vehicles to emerging economies where they will pollute the atmosphere and generate as much emissions as they did before. So, well, this is why we have to be quite cautious and why we're focusing now on implementation. So we're trying to get much beyond the kind of rhetoric. We all, there's a lot of greenwash about, which is understandable. Most entities now want to be seen to be pushing in the right direction for all sorts of reasons, because it's now politically expedient to do so. But there is a big gap. And I think this is where the health professionals do have an important role. I mean, in a sense, they're kind of the canary in the mine. You could say that, you know, what we need to be doing is to holding powerful interests to account. And in public health, of course, that's not, we're familiar with that broadly. I mean, public health community has stood up against the tobacco industry for many years with some mixed success, you know, but, you know, we have had some success in some countries. Tobacco industry is still making a lot of money, unfortunately, but it's, you know, it's certainly curbed some of its successes in some countries. And I think the health profession also needs to take the same view with the fossil fuel industry as well. We need to accelerate that and hold people to account, hold governments to account, nationally, but also subnationally as well. So I think this is really an emerging role for the health professional community, but they can't do it alone.
Let's come, Andy, to some of the questions. I know that when we have the hiccup in the middle that you answered some of them already, so stop me if you've answered these ones. But the one that gets most votes at the moment is, should GPs, and you're one of them, or you have been one of them, be telling their patients to eat less meat? That's very succinctly put, but there's a general point behind that, of course, about how general practice should be done. And it speaks to the point that you made well earlier, which is that it's not just about medicine. It's going to be a deeper reach back into the basic causes of ill health, including those associated with climate change. But what's your view? Do you tell your patients not to eat less meat?
Well, you know, we have to look at the evidence, don't we? So first of all, the evidence that meat is a problem. Well, we know that red meat is a major contributor to greenhouse gas emissions, and there's some pretty good evidence that it's harmful to health. I think the major health benefits actually come from not just removing red meat, but also increasing plant-based foods. Those confer major benefits. So, but we have to also be realistic about the impact of individual advice from health professionals. I spent quite a lot of my time as a health professional giving advice, some of it unsolicited, and it doesn't have an awful lot of effect, not as much as one would like to think, I can tell you. So the advice given by health professionals has to be quite carefully, I think, tailored to the circumstances of the patient. So some patients, of course, don't have the wherewithal, don't have the funds to buy the kind of healthy foods that they might want. So there's no point in lecturing them about healthy diets if they just don't have the resources to access those healthy foods. And healthy diets are a little bit more expensive than eating cheap, ultra-refined, cheap food, ultra-processed food. So as a GP, you have to be very aware of the kind of context, and you are, I think, of the communities in which you live, and be very cautious about giving unproffered advice which doesn't resonate with that community, and which they can't act upon, and just causes frustration and resentment. So what's more important, I think, is to think about those mechanisms that can help patients to make healthy choices the easy choice. And that means not just giving maybe part of it, but also maybe working with local decision makers, public health departments, local councillors, to make green space more accessible, to support things like, you know, food co-ops or whatever it is that enable people to have access to healthy dietary choices. So I think we have to avoid very simplistic kind of solutions and think more holistically about how we can improve prospects for our patients. And in doing so, seeing patients and the communities as allies rather than people to be talked down to or lectured to. I don't think that's going to be very effective. It needs to be combined also with government strategies which will improve the accessibility of healthy choices to communities, but through better pricing, better regulation, and so on. So we'll put it all onto the GP. GP can have a role, the family doctor can have a role, and the nurse, and so on. Incidentally, nurses are even more highly rated than doctors when it comes to public trust. So don't forget the nurses. They are absolutely crucial in all this.
Let's see if we can get to a couple more questions, Andy, before we finish. This is one that really speaks to our main theme, which is COVID and building back healthier. It's directed to both of us, but I'll ask you to answer it. It says, you, the panelists, have both spent time working and presumably commuting in London. Is the future rosy for megalopolises, big cities, or will they undergo a roller coaster transformation as remote working and home delivery takes over from commuting. So this is really a general question about our change of lifestyles. Is that change here to stay as a result of COVID, and will we be living healthier lives as a result of it?
Well, it's a very interesting point. Of course, and none of us know the answer for sure, but what I would say is I think some of these changes are probably permanent. I mean, will we really need to, certainly not to fly around the world for conferences. I think that's now. I hope these massive conferences, particularly medical conferences, I hope we can get away from those. And I think these virtual conferences work better. Of course, we still need to interact face to face. In terms of cities, I think there are some things that will change. So I think some of the virtual, in healthcare, for example, I think some of the virtual consultations will remain, but there are some conditions and some issues you have to see patients face to face. You have to really examine patients and have to interact with them on a face to face basis. So we shouldn't put everything into the teleconsultation, but some of it can be teleconsults, and where that's going to be done safely, then we can do it. We mustn't disadvantage people, of course, who can't access teleconsults easily. So again, we need to think about the potential inequalities. I do think that, it's made it more difficult to use public transport. I think that's one of the problems in urban settings at the moment. And public transport's a really important mechanism for getting large numbers of people around in relatively cheaply and also low environmental footprints. That's a concern. But I do think, hopefully, as the vaccine is rolled out and hopefully as COVID does recede into the rearview mirror over coming years, the public transport will make a comeback. I think hopefully will become more incentivized. At the moment, the private cars making a comeback in urban centres to some extent, in those centres where it's been perhaps reduced private car use in the past. That's a bit of a concern, and I hope we can get back to where we were and accelerate the movement towards walking, cycling, public transport in years. Whether cities will become less attractive, I sort of doubt that to some extent. I mean, I know that there's a temporary move, people are moving out to the country and so on. Whether that's a long-term trend, I sort of feel it's rather unlikely, but who knows exactly. But I do think that urbanization is likely to continue, particularly in those parts of the world where it's growing rapidly, and that's in places like sub-Saharan Africa and so on, because I think the cities have a tremendous pull effect in sub-Saharan Africa, despite the problems of informal settlements and so-called slums and so on. They still offer opportunities that rural living doesn't. We certainly need to make rural living much more attractive and small communities much more attractive. And to some extent, of course, the internet can help with that. Disseminated energy systems like mini grids and so on can make rural life much more attractive. So absolutely in favor of trying to improve the attractiveness of small communities and rural settings, but I suspect the cities will continue to be a magnet for population growth.
Yeah, and there has been, you referred to cycling, there has been an explosion of cycling during COVID. But in my understanding and knowledge, that tends to be in the rich world with relatively safe cities. And such an explosion in cycling is hard to imagine, say in Lagos, Jakarta, Sao Paulo, perhaps, or other big cities like that. So just very quickly, one final question, which expands and it's quite a big question. We've only got a couple of minutes left. And this is the intergenerational question that is often asked. In the political cliche, it's about our children's children. But when it comes to actually acting, of course, politicians are working on an election cycle, not on an intergenerational cycle. So quite briefly, Andy, how do we make the intergenerational case for equity?
Well, it's a difficult one, and that's why we've been focusing in our research and in our kind of messaging on the near-term benefits of moving towards a zero-carbon economy. So a zero-carbon economy offers many, many benefits for health and for wider well-being. And I've kind of enumerated a number of those, thinking what I've already. So I think emphasizing how we can achieve near-term goals and near-term benefits, as well as this longer-term goal of stabilizing the climate, keeping it well under 2 degrees, and making it possible for future generations to have at least some of the prospects that our generations had, I think is crucial. I do think that many people are, and perhaps COVID has also focused their minds on that. They are thinking about the kind of health and sustainability of their loved ones and their future generations. Young people have made a lot of sacrifices in COVID, actually, and the benefits to them have been pretty small because they are not the people that are dying. So I hope that will maybe foster a kind of intergenerational discourse, which also, where people middle and older ages also realize that they've got to make changes in order to really accommodate and make it possible for the aspirations of young people today, but also future generations to be fulfilled. I think if we work together in a spirit of collaboration and communication and listening, we can move quite rapidly. When I'm in an optimistic frame of mind, I would say we can move quite rapidly towards a decarbonised economy, because it does bring with it a lot of near-term benefits, as well as those long-term benefits that we've touched on. And I think that's what we've got to keep emphasising, the positive, because we know that just telling people it's going to be a catastrophe, and when you get to 2 degrees, the world is going to go to hell in a handcart, that doesn't necessarily motivate change. In fact, I think it motivates populism, cynicism, and I think it's potentially a flawed strategy. So the others are trying to really emphasize the fact that there are solutions, we need to scale them up. There's a lot we can do to work together, and that will be good for our mental and our physical health.
Andy, that sounds like a great note, a great positive note for us to end on. What I must do just before we end is point out to our audience the next talk, which is Martin Rees, Lord Rees, in conversation with Charles Godfrey, who's the director of the Martin School. And their pretty big topic is entitled Thinking Again About the Future and Prospects for Humanity. So that's coming up soon, and tune in then. So it just remains for me to apologise for the hiccup in the middle of this, where I was absent, but I imagine, Andy, you continued to talk fluently throughout. And a big thank you, Andy, to agreeing to do this. It's been illuminating as usual. It's always a pleasure to talk to you. So
thank you so much. It's been a great pleasure.
Thank you for the forbearance of the audience and your questions.
Yeah, thanks to the